I'm Sarah Baldwin. I'm a PT here at NCH Healthcare System, and today I'm going to talk to you about anterior hip precautions.
This is Raquel. She's our patient, and she's had a left total hip using the anterior approach. Your doctor will tell us what precautions you have based on what type of surgery he did, and we will give you written instructions while you're here at the hospital. The first precaution with anterior hip precautions is that you're not allowed to externally rotate or roll your leg out to the side. So even though I'm demonstrating on Raquel, I would not want you to do that. If you have a tendency when you relax for your legs to roll out, what we would do is take and prop something next to it to help hold it in place. Also, when you're walking, you wouldn't want to leave your left foot planted and twist to the right because that would turn it out. The second precaution is no crossing your legs. So Raquel can't cross her ankles, she can't cross her knees, and when she's lying or sitting, she needs to keep her legs apart. To make that easier in bed, what we'll do is just put a rolled up blanket or towel between her legs as a reminder. And the third precaution is no hyperextension at the hips. So you can't lean back, can't kick your operated leg back, and you can't bridge. So Raquel, bend your knees up, this one too, and lift your bottom up. So you wouldn't want to come way up because that would hyperextend at the hip. You can lift a little, but not very high up. Okay. So now I'm going to go over the total hip exercise program. The first exercise is pumping your ankles up and down. This is so you do not get blood clots, and we want you to do up to 10 repetitions every hour. You don't have to do them all at once. I always tell people if you're watching TV and a commercial comes on, pump them every commercial group. The next exercise is called quad sets. What you're going to do is push down with the back of both knees into the bed, holding this muscle tight for a count of 5 while you breathe, and then relax. So again, push down, hold. The next exercise is called a gluteal set. Raquel's going to squeeze her bottom muscles together. Hold them tight for a count of 5, and then relax. And we'll have you doing 10 repetitions of all these exercises. The next one is heel slides. She's bending her leg up and down. And your therapist will assist you if you need help with these, but usually by the time you're discharged, you can do them all by yourself. Okay. The quads, or the shoulder up quad is our next exercise. I'm going to put this under Raquel's leg. You're going to put it right under your thigh. Use that as your fulcrum and lift your foot up and down. And last but not least is hip abduction. Raquel will bring her leg out to the side and in, but not crossing midline. So right to there. Okay. And that's all the exercises. Pretty easy. Okay, Raquel's now going to get out of bed. So what we're going to have you do is push yourself on up to a sit, keeping your legs apart, and slowly walk yourself on around to get to the edge. Now scoot yourself forward. Okay, and just sit there. We always have you sit for a few minutes just in case you get dizzy because you've been laying flat for a little bit of time. Now we're going to demonstrate walking with the walker. Raquel will push up with her hands on the bed when she gets her feet to the floor. Push on up to a stand, keeping your head up, and straight up, and reach for the walker. Okay. We've already determined the walker is the right height for Raquel because it comes to the bend in her wrist when she's standing up tall. All right, Raquel's going to walk. She's going to start with one leg and alternate the other one. You do not do a step together. It's one foot in front of the other, walking as normally as possible. The other thing you want to make sure is that you don't put a lot of weight through the arms. Your leg's in better shape now following this surgery than it has been a long time, so it can support your weight. So just walk naturally, heel, toe. All right, and Raquel, we're going to turn around. So, yeah, you're turning to your operated side, so that's good. We don't have to worry about your leg turning inward or outward. And we'll walk back to the bed.
I can start with this one side.
You can start, yes. It doesn't matter which foot you start with because you're going to alternate your feet. Now this time, let's turn towards your right side. Raquel's now going to demonstrate turning to her right side, which is her non-surgical side, to maintain her hip precautions. So Raquel's going to turn her left foot in first, then turn the walker, then the right. Okay. Turn the left foot, So just enough to keep it straight, and then the right foot. Turn your left foot, locker, and keep backing on around. Left foot. Okay, now Raquel, you want to step back with your right foot first, and then slide the left foot back, making sure it's nice and straight, like that. Okay, back up till you feel the bed behind your legs. Put your operated leg out in front. Reach your hands back for the bed and lower yourself on down. There you go. Excellent. Okay, now I want you to scoot yourself back in the bed. Remember to keep your legs apart. You don't want them touching. And then slowly pivot your legs around into the bed. Okay, and then lie down and relax. You've done it. Good job.